with the sickle cell, if the paper that you're grading picks sickle cell, common manifestation should be something about you have anemia and pain and difficulty breathing, at least those things. Possible clots would, would be nice. I mean, I don't know you necessarily have to put that one. The pathophysiology should have something to do with literally having some red blood cells have sickle appearance and therefore can't carry enough blood. And it could cause clotting if they mention clotting. Does that make sense? Okay. You may have any questions on sickle cell, so I can move on down. Okay, KU. Yeah, that's still there. First off, did anybody have a paper that they actually picked PKU? Huh? Anybody actually picked PKU on their paper? Okay, no, yeah? No? So no. All right, then I'm not going to spend a lot of time doing that one. Again, the genetics are going to be the same on that if you did pick it. Where are we at? Oh, we moved on. Okay, let me go back to the chart because I'm not sure. I don't think I have everything on here. Okay, cystic fibrosis. Anybody pick cystic fibrosis on the paper? Okay, cystic fibrosis, they should have something with, they have difficulty breathing and thick mucus, okay, as far as these symptoms go, that they tend to be smaller, malnourished, okay? As far as the pathophysiology goes, there should be something about thick mucus, of course. How deep do I want to go on this? All right, so those of you guys that are grading papers that had cystic fibrosis, is there anything about chloride channels? If there is, don't ask, because that's fine, that's ideal. If not, what do you have for pathophys part of it? Did you guys have anything for pathophys part of it? Yeah. The clinical signs and symptoms? Okay. So, yeah. Okay, that's it. All right, it's kind of lame, but it's a first assignment, so that's okay. If we have the CFTR, transmembrane regulator, somewhere in there, they probably have no idea what it means, but we'll let it go because it's the first assignment. In the future, I need to know, or you need to know, who's ever graded, that they actually know what they're talking about. That's kind of the standard here. Okay. What else? Anybody else have a pathophys question on cystic fibrosis? Okay. Did anybody, I think I asked this, did anybody pick Neiman Pick? As in on the paper that you're grading? Nobody? Okay, I guess you don't need to go over that. Sickle cell, how about Tay-Sachs? I asked that one, right? So if somebody did pick Tay-Sachs on your paper? What did they say the signs and symptoms were? That's actually both. The description and the pathophys kind of. What about you? That? Okay, that's close enough. I mean, it's not deep, but it's fine. Okay, anything else? Yeah.
It's a neurodegenerative disorder manifestations, deafness, seizures, paralysis, decreased strength. This is caused by defective gene on chromosome. Doesn't make something that's destroying brain cells.
Huh? Something that's destroying brain cells?
We can't read the handwriting.
Let me look at that. Not sure what you got there. Oh, that's fine. Again, I don't know if they know what they're talking about, but that's fine for now. Just keep in mind in future assignments, this is actually applied pathophysiology. So we kind of do put a lot of weight on if you actually are explaining the pathophys, so we know that you know what you're talking about. Okay? Throwing in a whole bunch of words typically is not going to get you there unless you can explain what the heck it means. All right? Yeah.
Is there like a main resource that we could use for that? Because the book is very on and off.
Yeah, that's what I said before, is the book is not your best resource for the pathophys on a lot of these. Again, it's not like these are secret diseases. Google's usually fine. You just need to know the difference between listing signs and symptoms and actually explaining what's going on a physiological level, right? The lecture notes, in a lot of cases, will do a pretty good job. I don't know if they necessarily did on this or not. I can't remember that they did. But the first thing I would always do is I would do these homeworks. I would check the lecture notes, get as far as you can with those. You can always check the book, but it's really not a pathophysiology book. I mean, despite what the cover says. If you have to Google the pathophys, Google it. It's not like it's not out there. Okay. Thalassemia. Anybody have that one? Yeah. Sure. Can you read it louder? Okay. That's fine. In case you were listening, that it's kind of backwards on the pathophys. They did the pathophys first, which is basically making abnormal hemoglobin, and then the manifestations would be like the anemia things where they have what did you say? You said something. Should be something like pale, dizzy, tired. What else did you say? Little appetite is irrelevant. Huh? Okay. What about anybody else? Thalassemia? That you have a question on whether or not they answered it. with both the signs and symptoms and the pathogens. Okay. All right. Why my key doesn't have them all there? Okay, apparently we're going to category 3 then. Okay, again, everything in category 3 should be X-linked recessive. Okay, which means that your category 3 Punnett square is going to look like, depending on the question. First one, mother's heterozygous for disorder, father does not have the disorder. So father, nothing, mother, like this. Therefore, we have this, which means that 25% chance carrier, 25% chance disease, and 50% chance not affected. Okay, what did I put here? Oh. Okay, this is another way to phrase it, saying the same thing. If they got in sons and daughter in there somehow. Does that make sense? It really depends on how this was answered. Because if you actually answer the probability of having children, that's what I put in this over here. Okay, if for whatever reason the person decided to use male and female in their answer, then yeah, you have 50% chance of having an affected son. Actually, it's only, this is wrong, 25% chance of a carrier daughter and 25% chance of a daughter not having it at all. Depending on how they phrase that. Hopefully most people phrase it the way I originally wrote it. Questions? Yeah.
What is the 50% chance of having an affected son?
It's it's again the way that they phrased it. So if you're only talking about sons, then you're only talking about half of the kids anyway. So out of half of the kids, half of them will be affected and half not. If you're only talking about boys. Does that make sense?
It's recessive, so I don't know why
No.
only the boy and one boy having the disorder.
Yes. And that's what it says.
50% of boys.
Of boys, yeah.
Got it.
That's what I'm saying. If they phrased it like only of boys, then half will have the disease, half will be completely affected. Again, most people probably did not phrase it like that, but I put it in there anyway. Just because it's not wrong, it's just different phrasing. Yeah?
So my question was that it was, what they did,
You gotta have both. For that first box, it has to be the whole X-linked and recessive. That's just one up, because it's worth 1 point. If they know what they're talking about, they're gonna get their points back in the other questions, because their numbers will come out right. Yeah. that's true. What about carrier? Because you have to say if there are carriers, that's one of the questions in there. So the carrier part would not be there, so it's wrong. Again, yeah, in that case. That's a little different than that first time when I said as long as your math adds up, because 50 and 50 obviously that's 100. But in this case, they are mutually exclusive, or they're not mutually exclusive. The other case, it was where you could have this or that, so you just have to throw in the third part. In this case, you can have this or that, but on that, there's two categories of it. So you do have to mention that there's no carriers. Or there is a carrier, a 25% chance of carrier. And again, that's for anything in that third row, whatever that happened to be. Okay? Questions on that? Alrighty, so, oh, there were more questions on there, weren't there? So that was one. The second one is the mother is heterozygous for disorder, father has the disorder. Okay, so in this case, father has the disorder, mother heterozygous, which means that person here is affected, has the disease, that female. This male has the disease, this female is a carrier, and that male is not affected at all. Okay, so if you're looking at it this way, 50% of the children have the disease, 25% are carriers, and 25% do not have it. Again, there are 3 questions in each of these, so. Question? What's that? Yes. Yeah, if they went with male and female, you're gonna see where 50% females have the disease, and 50% of the females are carriers. As opposed to 50% of the males have disease, males, and 50% of the males are disease-free completely and not carrier. Okay, again, if they use the male and female thing, that's just a different way to phrase the same thing. Okay? Yeah.
I think the male female percentages out of 100, so they didn't do like, supposedly 25% is having a boy, and they said that, of the boys, you got a 50% chance. That's what they did.
Because, yeah, that's true. I mean, yes, it should make sense, right? If you look at that, you can say 25% chance of having a diseased boy, because that's 2 different qualifiers, right? The disease and a boy. Out of that, that is 25%. Okay. It's just, again, it's a matter of phrasing, and again, if I haven't said this, that's gonna be the main trick when you actually are answering these things on tests, is exactly what is being asked, okay? Alrighty, so there's a third question. Mother is